Hello and welcome back to Medical Voices, the podcast where we learn the language of healthcare, one real conversation at a time. I'm Nadia.
And I'm Tom. Good to be back.
Before we start, a quick but important note. Everything you hear on Medical Voices is here to help you learn the language of medicine. We are not here to give medical advice, and nothing in this episode should be taken as clinical guidance.
We are language teachers, not your doctors, or your pharmacists, as the case may be today.
That is a very good segue, Tom, because episode 2 picks up exactly where we left off. In episode 1, Mr. Davies visited Dr. Bennett's surgery for the first time. Headaches, 2 weeks, tension type. Dr. Bennett decided against a prescription and recommended some lifestyle changes, but she did say, "Come back if things don't improve."
Things did not improve. So Mr. Davis went back, and this time Dr. Bennett issued a prescription. And now he needs to get it filled.
Which means today's setting is the pharmacy. A completely different clinical environment from the GP clinic. Different vocabulary, different kind of conversation, different register. But some of the words from episode 1 will come back in a new context, which is exactly how language learning is supposed to work.
10 vocabulary terms, a realistic pharmacist and patient dialogue, a language breakdown, and a quiz. Let's get into it.
Right, before we get into the dialogue, let's make sure we have the right words. 10 terms. I'll give you the word, the definition, and an example sentence. Pause and repeat whenever you want to.
Terms 9 and 10 are ones you've already heard. We'll flag them when we get there.
Term 1. Prescription. A prescription is a written or electronic authorization from a licensed clinician, a doctor, a nurse practitioner, that allows a pharmacist to legally dispense a specific medication to a patient. Without it, a pharmacist cannot hand over a prescription-only medication. Example. Mr. Davies handed over his prescription at the pharmacy counter.
Term 2. Medication. Any substance used to treat, prevent, or manage a disease or condition. You will hear medication and medicine used interchangeably in everyday English. Both are correct. In a clinical context, medication is slightly more formal. Example. The pharmacist checked that the medication matched the prescription exactly.
Term 3. Dosage instructions. These are the pharmacist's specific directions for how to take a medication correctly. The dose, how often to take it, for how long, and any special conditions like taking it with food or avoiding certain drinks. Getting dosage instructions right is one of the most important parts of a pharmacy interaction. Example. The pharmacist went through the dosage instructions carefully before handing over the medication.
Term 4. Side effects. These are unwanted reactions a medication may cause in addition to its intended effect. Most medications have a list of possible side effects, some common and mild, some rare and more serious. In a pharmacy context, a pharmacist will typically flag the most likely ones. Example. The pharmacist mentioned that drowsiness was one of the more common side effects.
Term 5. Contraindication. A contraindication is a specific condition, factor, or other medication that makes a particular treatment potentially harmful and therefore something to avoid. This is stronger than a side effect. A side effect might happen. A contraindication means the medication should not be used in those circumstances. Example. The pharmacist asked about other medications he was taking to check for any contraindications.
Term 6. Over-the-counter. A medication is described as over-the-counter when you can buy it directly at a pharmacy without needing a prescription. Paracetamol, ibuprofen, antihistamines, these are all typically over-the-counter. You heard this term in episode 1, when Mr. Davis mentioned he had been managing his headaches with over-the-counter ibuprofen. Example: she asked whether the medication was available over the counter or if she needed a prescription.
Term 7. Generic medication. When a medication's patent expires, other manufacturers can produce the same active ingredient under a different name, usually at a significantly lower cost. That is a generic medication. The active ingredient and clinical effect are identical, only the brand name and price differ. Example: the pharmacist offered a generic version at a lower cost and explained that it contained the same active ingredient.
Term 8. Repeat prescription. A repeat prescription is an authorization that allows a patient to receive the same medication again without needing to return to the doctor for a new consultation, as long as the prescribing clinician has set it up that way. It is very common for chronic conditions or ongoing treatments. Example: the GP set up a repeat prescription so the patient could collect the medication monthly.
Term 9. Allergy. You heard this one in episode 1. Mr. Davies reported a penicillin allergy during his consultation with Dr. Bennett. Allergy flagging does not stop at the GP's surgery. It is just as important at the pharmacy counter because the pharmacist needs to check that the prescribed medication is safe given the patient's known allergies. Same word, new context. Example: before dispensing the medication, the pharmacist confirmed there were no known allergies that could cause a problem.
And term 10. Follow-up. Also from episode 1, Dr. Bennett asked Mr. Davis to book a follow-up in 2 weeks. At the pharmacy, the follow-up comes up again naturally, because the pharmacist will often remind the patient to attend any scheduled appointments as part of their overall care plan. Same word, different clinical setting. Example: the pharmacist reminded him to keep his follow-up appointment with Dr. Bennett.
10 terms. You will hear all of them in the dialogue coming up. If anything felt unfamiliar, now is a good moment to pause and go back.
Ready when you are.
All right, and now, as always, it's time for our role play. Today, I'll be the pharmacist.
And I'll be the patient. Mr. Davis, prescription in hand, let's go.
Good morning. How can I help you?
Morning. I have a prescription. My GP, Dr. Bennett, gave it to me at my appointment earlier this week.
Of course. Let me take a look at that for you. Right. So Dr. Bennett has prescribed you a short course of amitriptyline. That is a medication used to help manage tension-type headaches when they are frequent and not responding to over-the-counter options. Before I go any further, do you have any known allergies to medications?
Yes, penicillin. I mentioned it to Dr. Bennett.
Good, and I can see it is noted on the prescription. Amitriptyline is not related to penicillin, so there is no issue there. I just always like to ask directly. Now, let me go through the dosage instructions with you. Dr. Bennett has prescribed a low dose. You will take 1 tablet each evening, about an hour before bed. You take it at a low dose for headache prevention. It is quite different from how this medication is used at higher doses for other conditions. The course is 6 weeks.
1 tablet in the evening for 6 weeks. Got it. Are there any side effects I should know about?
Yes, and it is worth knowing about these before you start. The most common side effects at this dose are drowsiness, a dry mouth, and occasionally some mild dizziness in the morning. The drowsiness is actually part of why you take it in the evening. It tends to wear off by the time you wake up. These side effects are usually mild and often settle down after the first week or two.
And if they do not settle down?
Then go back to Dr. Bennett. Do not just stop taking the medication without speaking to her first. Stopping abruptly is not advisable. She will guide you on how to reduce the dose gradually if needed. Are you taking any other medications at the moment?
Just the occasional ibuprofen over the counter for the headaches. I've been doing that for a while.
Right, that is actually something to be careful about. Taking over-the-counter pain relief too frequently can sometimes make headaches worse over time. It is called medication overuse headache. The amitriptyline is meant to help break that cycle. So while you are on this course, try to use the ibuprofen as little as possible. If you feel a headache coming on, let the amitriptyline do its job rather than reaching for the ibuprofen straight away.
That makes sense. Is there a generic version of this, by the way? It looks quite expensive.
Good question. Yes, there is. Amitriptyline is actually already a generic medication. It has been off patent for many years, so what you are getting is already the most cost-effective version available. The active ingredient is identical regardless of which manufacturer produces it.
Oh, I did not realize. That is good to know.
One more thing. Dr. Bennett has your follow-up scheduled in 2 weeks. Please do keep that appointment. It is important for her to assess whether the medication is helping, whether the side effects are manageable, and whether the dosage needs any adjustment. The prescription is for 6 weeks, but she may want to review things sooner, depending on how you get on.
Will do. And if things are still not improving after the 6 weeks?
That is a conversation to have with Dr. Bennett at the follow-up. She may decide to extend the course, change the approach, or consider a referral. That is her call to make, not mine. My job is to make sure you have everything you need to get started safely. Any other questions?
No, I think I have got everything. Thank you very much.
You are welcome. Take care and good luck with it. We are going to repeat 3 key exchanges from that dialogue, a little more slowly so you can really focus on the phrasing.
Listen out for the vocabulary terms and how they come up naturally in the conversation.
Let me go through the dosage instructions with you. You will take 1 tablet each evening, about an hour before bed. The course is 6 weeks.
1 tablet in the evening for 6 weeks. Got it. Are there any side effects I should know about?
The most common side effects at this dose are drowsiness, a dry mouth, and occasionally some mild dizziness in the morning.
And if they do not settle down?
Then go back to Dr. Bennett. Do not stop taking the medication without speaking to her first. Stopping abruptly is not advisable.
Is there a generic version of this, by the way?
Amitriptyline is actually already a generic medication. It has been off patent for many years, so what you are getting is already the most cost-effective version available.
That is good to know.
One more thing. Please do keep your follow-up appointment with Dr. Bennett in 2 weeks. It is important for her to assess how the medication is working.
Great. Let's break that down. There were a few expressions in there worth looking at more closely.
6 things. Some vocabulary, some phrasing patterns, and one really important clinical distinction at the end.
Let's start with dosage instructions. In the role play, Nadia covered them in one clear sequence. 1 tablet in the evening for 6 weeks. That is the classic pharmacist structure: dose, timing or frequency, and duration.
When you are working in a clinical English environment, or when you are preparing for an OET interaction, You will need to deliver or document dosage instructions in exactly this order. Dose first. How much? Frequency second. How often or at what time of day? Duration third. For how long? And then any special conditions. With food, with water, avoid alcohol, avoid driving. If you can cover those 4 elements clearly and in that order, you are communicating dosage instructions correctly.
The patient's response in the role play was good too. 1 tablet in the evening for 6 weeks. That is a patient confirming their understanding by repeating it back, a technique called teach back, which is encouraged in patient communication because it reduces errors.
Now, the difference between side effects and a contraindication. These 2 terms often get confused, and it matters clinically.
A side effect is something that may happen as an unwanted consequence of taking a medication. It is possible, not certain. Some people experience it, some do not. A pharmacist flags side effects so the patient knows what to watch out for.
A contraindication is something that makes a medication inadvisable or potentially harmful in a specific situation. It is not a possible outcome. It is a reason not to use the medication at all or to use it only with extreme caution. In the role play, when I asked about allergies before dispensing, I was checking for a contraindication, not a side effect.
So, side effects are possible risks of taking a medication correctly. Contraindications are reasons not to take a medication in the first place. 2 different categories, 2 different clinical responses. Point 3. Generic medication. Mr. Davis asked whether there was a generic version, and the answer was that amitriptyline is already a generic. It has been off patent for decades.
This is worth knowing because patients frequently ask this question, especially when looking at the cost of their prescription. A generic medication contains the same active ingredient as the original branded version. The clinical effect is the same. Only the brand name and often the price are different.
In clinical English, particularly in pharmacy settings, you will hear pharmacists say things like, "We have the branded version and a generic option." Or, "This is already available as a generic, so what you are getting is the most cost-effective version." Being comfortable with this vocabulary helps you hold that conversation fluently.
Point 4. This one is a language and clinical awareness point combined. In the role play, I introduced the concept of medication overuse headache. That is the term for a situation where taking pain relief too frequently actually makes headaches more frequent or more severe over time.
Notice how Nadia introduced a clinical concept clearly, without diagnosing or prescribing. She said, "This is called medication overuse headache." She named it. She explained what it is. She gave the patient clear guidance. Use the ibuprofen as little as possible while on the course. But she did not say, "You definitely have this." She framed it as something to be aware of.
That framing is important in clinical communication. You can educate a patient about a clinical concept without overstepping your role. Naming, explaining, and advising, yes. Diagnosing, no.
Point 5. The allergy check. In episode 1, Mr. Davies told Dr. Bennett about his penicillin allergy. In episode 2, the pharmacist asked about it again, independently.
That is not an error or inefficiency. It is a deliberate clinical safety step. Every point of care, GP, pharmacy, hospital, specialist, has an obligation to verify allergy status independently. It is one of the most common sources of preventable harm in healthcare, and it is one of the reasons why allergy information is meant to be flagged on every prescription, every chart, every patient record.
The language of that exchange in the role play was very simple. Do you have any known allergies to medications? Yes, penicillin. It is noted on the prescription. Amitriptyline is not related to penicillin, so there is no issue there. Short, clear, and clinically complete. That is what good allergy communication sounds like.
And point 6. The register shift, which we looked at in episode 1 from the GP's perspective. Here it is again from the pharmacy counter.
Patient language in this episode. I've got a prescription. Are there any side effects I should know about? Is there a generic version? Conversational, informal, natural.
Pharmacist language. Dr. Bennett has prescribed a short course of amitriptyline, a medication used to manage tension-type headaches. The dosage instructions are as follows. Before I go any further, do you have any known allergies? Precise, structured, safety-conscious.
Same person, same room, two completely different registers. That is what clinical communication looks and sounds like. And learning to move between the two is one of the core skills this podcast is building, episode by episode.
Which brings us to the quiz.
And now, quiz time. 3 questions. Nadia, you ready?
Always.
Question 1. What are dosage instructions? Name the 3 core elements a pharmacist will typically cover. 5 seconds. Think before you listen.
Dosage instructions are the pharmacist's directions for how to take a medication correctly. The 3 core elements are the dose, how much to take, the frequency, how often or at what time of day, and the duration, for how long. A pharmacist may also add special conditions, such as taking the medication with food or avoiding certain activities.
Question 2. What is the difference between a side effect and a contraindication? 5 seconds.
A side effect is an unwanted reaction that may occur when taking a medication as intended, possible but not certain. A contraindication is a reason not to use a medication at all in a particular situation because it could cause harm. Side effects are risks of using a medication. Contraindications are reasons to avoid it.
Question 3. What is a generic medication, and why might a pharmacist offer one instead of the branded version? 5 seconds.
A generic medication contains the same active ingredient as the original branded version and produces the same clinical effect. It is available at a lower cost because the original patent has expired and multiple manufacturers can produce it. A pharmacist might offer a generic because it gives the patient exactly the same treatment at a reduced price.
3 questions, 3 clear answers. Well done if you got those, and if you did not, the vocabulary section in your PDF transcript has everything you need to review.
That is it for episode 2. Next time, we are back at Dr. Bennett's surgery. Mr. Davis has his follow-up appointment. The medication has made a difference, but he still has some symptoms to describe. Episode 3 is all about the language of describing symptoms in a clinical consultation. How do you talk about pain, duration, location, severity? How does the doctor ask, and how does the patient answer? Big vocabulary episode coming up.
See you next week.
See you next week.